Hello, welcome to Chronic Disease Hates Your Guts, presented by myself. I'm Dr. Vreeland. Let me give you a little background about myself here before we get started, so you know who you're listening to. I'm a functional neurologist and functional medicine doctor. I practice in Norwich, Vermont. I lecture quite regularly around the country for a company called Biotics Research Corporation, and basically I lecture on the benefits of nutrition and lifestyle changes and basically the prevention of chronic disease and the treatment of chronic disease. I've designed a line of supplements for them that is really targeted for neurologic health, and I'm exceptionally passionate about helping patients who've not been able to get help elsewhere. They've seen all of the other doctors and they've not been able to get help, and through our functional approach we're able to help. And what do we use? Well, we use dietary modification, we use supplementation, we use exercise, and that is really although it sounds like basics, it's really an important piece to overall health. At the Vreeland Clinic, we like to say we get extraordinary results because we are dedicated to treating the person with the problem and not the problem with the person. There's nothing worse than going into a doctor and not only not getting your questions answered, but not being able to get your particular entire health picture looked at. With this modern medicine here, we're very specialized, and that I believe leads to some issues. So we're going to talk about how the chronic disease and how the gut interact, and basically how to treat it. Okay. So what are the basics? Well, the basics are, what does the gut do for us? Well, it digests our food and it absorbs our nutrients and it's waste elimination, and that's, you know, a lot of the basic people know about those things. But it houses trillions and trillions and trillions of symbiotic bacteria, and most of them are symbiotic. Sometimes they get out of balance, and that can be a problem. Forms a barrier between the outside world and our internal environment. Really, really important piece. We'll talk a lot about that here in the next hour. And it houses the majority of the immune cells in our body. Also a very important piece, which we will talk quite a bit about. This looks pretty complex, okay? So I'm going to give you the basics of it, okay? So here's the stuff up in the left-hand corner in yellow. This is all the stuff we don't have much choice about, right? We can't really control how we're born, but all of this is starting to show, we're starting to show that the gut health begins when we're born, right? If we're vaginally delivered and we're breastfed, and then we make all these good choices when we are adults, as highlighted by here in gray, we have a decreased risk of chronic disease, right? Minimal NSAID use, we'll talk about what that is. Good nutritional status, moderate alcohol use, little to no antibiotics, regular vigorous exercise, and we manage stress. But if we go the other way, let's start up here. If we go birth and we have a cesarean section, sterile birth, and we're bottle fed, and then we make all of these wrong choices, we're almost guaranteeing ourselves we're going to get some kind of chronic disease. So it's really important. We're going to break all these down here in a little bit. So we are more bacteria than we are human. There's approximately 100 trillion bacterial cells in our gastrointestinal system, 3 to 4 times the total number of cells in the rest of our body. Okay, so what does 100 trillion look like? Well, that's what it looks like. It's a huge number. Little perspective. If you spent $42,000 a second for 75 years, at age 75 you'd have $661.5 billion left. That's how big that number is. And so it's really important that we look at this as an inner organ, the balance of the bacteria and the total load as an inner organ. And disruptions in that organ lead to dysfunction in our body, just like dysfunction in your liver or your heart or your kidneys would lead to other problems. Dysfunctions in the balance of this bacteria lead to other issues. Another way to look at it, we are, again, mostly bacterial cells. We've got a little bit of fungus in us that's normal, and there's our human cells. Now there's lots and lots of genetic material, okay? So for every one human gene, there's 360 microbial genes. That's a huge number, and that is a big there's a lot of genetic code there, and all of that matters because that influences how the bacteria communicate with us, and in turn how we communicate with them. So it's a large portion of the genetic material in our body is actually from bacteria. A couple definitions. When I say microbiota, that represents all the microorganisms that live in a particular environment, like the human body, for example. And it's different. The microbiota that's on our skin is different than the stuff that's in our nose. It's different than the stuff that's in our gastrointestinal tract, but it's all microbiota. The microbiome. If we look at the entire collection of human genes, it's called the human genome, of course, and we've sequenced that. We know what it looks like. We don't know all of the function, but we know what it looks like. But the microbiome is the entire collection of genes found in that microbiota associated with a particular host, like human beings. So where does this biome come from? Well, it begins with birth. I'm sorry to tell you, and you didn't have much control over that, but it does. Bacterial exposure in the birth canal is very important. Breast milk is the second exposure. It should go in that order. What happens when when children have cesarean births, it's a sterile birth. The first exposure that they get to bacteria is perhaps the skin of the mother. That should not be the first bacterial exposure. It should come from the birth canal. Then perhaps they're bottle fed. If they're bottle fed, they don't get the bacteria and the healthy immune stabilizing immunoglobulins that are in breast milk. Okay, so really what we want to strive for is a reduction in cesarean births, and we want to make sure that we breastfeed all of our babies. Now, if that didn't happen to you, not to be worried. If you make all of the other right choices, it appears that we can kind of sort that out. But if you're a parent or you're thinking of becoming a parent, it would be wise to do everything you can do to make sure that you have a natural vaginal birth, because it sets up the child for a much better favorable health outcomes later. Now, as babies grow, they're exposed to other things in the world, right? They come into contact with other people. They come into contact with family pets. They eat different types of food, and they put things in their mouths, and they do all the things that babies do, and that helps to grow the exposure. And it's beneficial. We're starting to see that the more we become, the more sanitary we are, the more problematic we are. The more problems we have with allergies, for instance. So we don't want to be overly hygienic. Of course, we don't want to be the complete opposite end of the spectrum, but it's not a bad thing for your baby to crawl around and put stuff in his or her mouth. Now, the bacteria select where to live in the body based on interactions with the host's genetics, with the baby's genetics, and with the bacteria that are already there. It says, okay, I know where I'm supposed to be. I'm surrounded by a bunch of other things that look like me. I'm going to hang out here. And that's how we get different types of bacteria in our skin versus our gastrointestinal tract, etc. So what are the diseases that are linked to the microbiome? Well, we see inflammatory bowel disease, autoimmune disease, diabetes and obesity, heart disease and cancer, and then even things that a lot of people don't think are related, like insomnia, anxiety, depression. Yes, even mental disorders, disorders of the brain, are related to the gut. And we're starting to see that even things like Alzheimer's disease are linked. And I'm going to show you that this link is primarily through inflammation and how that works. Now, how does this biome affect us? Well, these microbes, the microbiota that are in us, are highly metabolically active. And they secrete these chemicals that we call metabolites. And these metabolites can pass through the gut wall into the bloodstream and circulate throughout our bodies. A phenomenon called leaky gut, and some of you may have heard of that before, complicates this picture. Okay, so we get unregulated circulation of metabolites and also toxins throughout the body. So we want to make sure that we don't have a leaky gut, because these microbes are so metabolically active. We want to keep the stuff inside the gut that's supposed to stay inside the gut. And the stuff that we want to get through the gut wall, we want to get through the gut wall, but we want it regulated. Okay, and that's important. The gastrointestinal tract should be selectively permeable. Okay, so again, the things that get in are the things that we want to get in. All right, when that process becomes deranged or dysfunctional, leaky gut occurs. So what I want you to look at here, this is inside the gut here. You can see my mouse. And then outside of the gut is there's a blood supply at the bottom of these cells. And these are individual cells lined up next to each other. Really important factors are these blue tight junctions, okay? And they hold the cells together. They keep the cells together, and they hold them there nice and tight so stuff doesn't sneak between them and get into our bloodstream. That's an important factor. We're going to talk a lot about that. And you can see with the arrows here, again, the tight junctions. So how does a leaky gut occur? what causes leaky gut? And we're going to go through a lot of these. Well, start at 12 o'clock here with alcohol and work our way clockwise. Alcohol breaks down the gut barrier. Then a slew of vitamin deficiencies: calcium, vitamin A, zinc, magnesium, vitamin D. That causes breakdown in the gut barrier. The high fructose diet and the Western diet. What's the difference there? Well, high fructose is, fructose in terms of high fructose corn syrup. And the Western diet, they generally say is a diet that's high in processed foods and generally high in calories. Antibiotics will do it. That's a big concern. And then antibiotics cause something called SIBO. SIBO is an acronym for small intestinal bacterial overgrowth. Physical stress and psychological stress. The body views them the same, and I want you to consider this as well, is that under this physical stress category is lack of exercise. Lack of exercise is actually a stressor on the body. And then NSAIDs. NSAID stands for non-steroidal anti-inflammatory drug. Those are things like aspirin, ibuprofen, Aleve, all those drugs that we take, or a lot of people take every day for pain. Okay, and we're going to talk about most of these and how they cause leaky gut. So, who cares if it's leaky, right? You say, well, big deal, a little extra stuff gets in. Who cares? Well, there's toxins that are associated with the gut barrier, that are associated with the bacteria, excuse me. These toxins, we call them LPS. LPS is short for lipopolysaccharides. Now, you don't necessarily need to know what that big word. We're just going to refer to it as LPS. But what they do is they get through the barrier, and they stimulate a very powerful immune response, which is inflammatory. And here's where we start to make the case for leaky gut causing these toxins allowed to get through into the bloodstream, and an inflammatory response. So these LPS, what are they exactly? Well, these are toxic structures that are present on the surfaces of certain types of bacteria. Most of the bacteria in the gut have these LPS. And you can see here the bacteria are represented by these green circles, and the LPS by these orange little hook-shaped things. So what happens when the bacteria die, these toxic LPS are now free. And if they make their way to the gut wall, and there's a leaky gut, they get into through that gut barrier, and they get into the bloodstream, where a potent immune response is generated, and that's inflammatory. And we're going to talk about why that's a problem. So let's get a little bit deeper into this. So let's look at how vitamin and mineral deficiencies, a poor diet, NSAID use, antibiotic use, alcohol use, stress, and then also food sensitivities and allergies. How do they cause leaky gut? So vitamin and mineral deficiencies. Okay, so we have our tight junctions right here. Okay, and this is a healthy gut on the left. It's nice and healthy. Tight junctions are in place. Here's a leaky gut. Okay, now these particles, these toxins, can get through because the tight junctions have been eliminated or reduced, or they're weak. Okay, so vitamin D, vitamin A, magnesium, zinc, and calcium are really important for maintaining the structural integrity of these tight junctions. When you have deficiencies in these vitamins, we get structural breakdown, and the barrier becomes dysfunctional. And now all the stuff that we want to keep in the gut and just eliminate, actually we absorb, and it causes an inflammatory response. And you might say, that sounds interesting, but I get enough nutrients. I don't need to worry about that one. Maybe you do, maybe you don't. This is an interesting statistic here. 8% of Americans don't get enough zinc, 34% don't get enough vitamin A, 38% not enough calcium, 45% not enough magnesium, and up to 70% of patients don't get enough vitamin D. I would say in my neck of the woods here in Vermont, that number, the 70% people not getting enough vitamin D, might even be higher than that. So it's not a foregone conclusion that you're getting enough of these. So you need to know your nutritional status. Poor diet. So diets high in fructose, like high fructose corn syrup, and added sugar can cause leaky gut. Fructose actually increases the ability of the toxic LPS to get through the gut barrier, leading to more inflammation. Also, diets high in calories do the exact same thing. And what's high in calories? Well, it depends on your activity level. If you have a very, very highly active, you might be able to eat 3,500 calories a day. But if you're not very active, you might be eating too much at 2,500 calories a day, or even 2,000 calories a day. So that's subjective. In my office, what we do is we look at these things from a scientific standpoint, and we determine Are you eating too much, or sometimes not enough, believe it or not? So what it does, again, diets high in calories take the toxic LPS and they allow it to get out of the gut and create this inflammatory response. So the poor diet, high fructose corn syrup. It's easy to spot the stuff that's high, right? It's the stuff you see on the screen here. It's your cake, it's your candy, it's your sugary beverages, etc. But it starts to sneak in. Now you see, oh, geez, it's in my orange drink, which I didn't think it was there. It's in my Cheez-Its. They don't taste particularly sweet. Why do they have it in it? It's in my Welch's grape jelly. I thought this was good for me. I thought this was grapes. And then it's even in my salad dressing, which isn't particularly sweet. And then, well, it gets even a little more confusing. The Healthy Request Campbell's soup, vegetable soup, which is supposed to be good for us, has it in it. My prunes that I take that are supposed to keep me regularly, they're supposed to be good for my health. They have it in it. And then you look at things like your pickles. You wouldn't think your pickles have it in it, but they do. And then it gets really strange. Now it's in my whole wheat bread. It's in my Raisin Bran cereal. It's in my breadcrumbs. It's in everything. It's in my crackers that don't taste sweet. So it sneaks into everything. And it's part of the American diet now, unfortunately. And they do it because it sells product. And people like the way these things taste, even though they don't know that they've got high fructose corn syrup in it. And so it's a marketing thing. All right? There's 600,000 different products in American grocery stores. 80% have added sugar. The vast majority of that is as high fructose corn syrup. You say, geez, why do they use that? Well, they use that because it's liquid and it's cheap. And most of that added sugar is as high fructose corn syrup. So here's how it works. We've got fructose or excessive calories up here in the upper left. And we consume those. Yum, that was good. And that causes those toxic LPS to get through the gut barrier. Okay? And when they get out through that gut barrier, the immune system has to react because remember those LPS are very stimulate a very potent immune response. And they respond, the immune cells respond by creating inflammation as labeled by these yellow or yellow stars here. And then if that process continues unchecked and it happens over and over and over again, eventually that inflammatory response overwhelms the system and then begins to alter systemic inflammatory load with all of its consequences. Increased pain, poor mood, cloudy headedness, fatigue, etc., etc. All because you're consuming too much fructose or too many calories, perhaps. Chronic NSAID use. So like I said, how does this contribute? NSAIDs are aspirin, Motrin, Advil, Aleve, Excedrin, other types of pain relievers. How long before damage occurs? Well, damage is visible. Once you start taking these, damage is visible just 12 to 24 weeks after use, but more sensitive chemical testing shows that there's damage within 2 weeks, just 2 weeks of use. The inflammation begins to rise even sooner, as early as 3 days after beginning use of these NSAIDs, and can persist as long as 16 months after the discontinuation of treatment. Okay, so these are very powerful drugs. They are helpful in some respects, but they break down the gut barrier. And we're taking them to reduce our pain, but we may be actually hurting ourselves in the long run. And I hear you saying out there, but I use the enteric-coated NSAIDs. I don't need to worry. So they're enteric-coated, so they're going to protect my stomach. All it does, the research shows, is all that does is that shifts the damage from the upper part of the gastrointestinal tract to the lower part. So unfortunately, taking the enteric-coated NSAIDs doesn't do anything for you. Now, there's several mechanisms by which this affects and causes leaky gut. I'm going to go through them here. So the NSAIDs bind to the cell surfaces here, number one. And what they do, through a lot of complex interactions, it results in decreased energy production in the gut wall. If your cells are not producing energy, guess what? They can't do their jobs very well, and that breaks down the gut barrier. Secondly, NSAIDs cause calcium to leak out of the cells. That causes the tight junctions to break down. What was the first thing I told you guys? Was that the tight junctions need calcium, and that calcium deficiency can cause those tight junctions to break down. So we don't want calcium leak out of the gut, out of the cells that line the gut, and that's what NSAIDs do. So now that all of those things, those two processes have occurred, we've reduced our energy production, we've caused calcium to leak out of the gut. Now things that are naturally in the gut, like bacteria and bile acids, undigested food particles, and other types of toxins, now they have access to the barrier, or greater access to the barrier, and they break it down even more, causing more and more inflammation. Okay, so now our gut is really broken down. So that's how NSAIDs cause the problem. Antibiotic use, very simple. Okay, antibiotic use on the left, normal gut on the right. All right, so antibiotics kill all good, I shouldn't say all, they kill a lot of good and a lot of bad bacteria, and it alters this balance. So all the symbiotic functions that the bacteria do for us in terms of nutrient absorption, in terms of assistance in digestion, in terms of assistance in metabolism, are lost when you have antibiotic overuse. And well, I will say is that according to the New England Journal of Medicine, 50% of antibiotic use is unnecessary. So unless you absolutely need antibiotics, you should not be using them. It will absolutely disrupt gut function and lead to more and more inflammation. Alcohol use. So alcohol breaks down those tight junctions, and it increases the toxic LPS in the blood. All right, so it breaks down the tight junctions. It also increases the ability of those toxic LPS to get into the bloodstream and cause inflammation. And you might say, well, I don't drink enough to be a major issue. One study found that the alcohol in just one drink is enough to break down the gut barrier. Just one drink. Okay. That being said, there is quite a bit of study out there that shows that moderate alcohol consumption is actually beneficial for health, and perhaps it has to do with some of the chemical properties, perhaps it has to do with stress reduction. Nobody's quite sure. It's one drink every once in a while is probably not going to be an issue. If you go above 1 drink per day for women and 2 drinks a day for men, that will increase leaky gut and increase the risk of chronic disease. Okay? Stress. We've all got it, and your body doesn't view physical or psychological stress any different. Okay, so it doesn't respond any differently. And what I'd like you to remember, I said this in the beginning, that physical stress is also incorporated in this under physical stress is lack of exercise. So if you're not exercising, you are under stress. And it's a major problem. You know, according to the American Institute of Stress, 44% of Americans feel more stressed than 5 years ago. 75%, 3/4 of doctor visits are for stress-related ailments. 40% of people, 40% of stressed people overeat or eat unhealthy foods. So this contributes. This is a vicious cycle. So you're stressed, so you eat poorly. So that contributes to stress. So you eat poorly, and it's a vicious cycle. You have to break the cycle. 44% lose sleep because of their stress, and that's another added stress, another vicious cycle there. So how does it affect our gut? Well, it affects a very protective molecule called secretory immunoglobulin A. So I'm going to call it SIG-A. SIG-A is released by the immune system in all mucous membranes. So it's present in our lungs, it's present in our mouth and our nose, and it's present in the entire gastrointestinal tract, and it acts as a first line of defense against toxins, against bacteria, against viruses, against fungus. And so it's a really important molecule to have plenty of. And guess what? Stress reduces SIG-A. So up here you see we have in the top left here by my mouse we have SIG-A. That's a little thing I just made up. And these are toxins, okay, that I've put in here. And SIG-A binds those toxins, and it prevents them from making their way to the cell surfaces, okay, and allows those toxins to pass out of the body so they don't have any effect. But if you're under a lot of stress, you have very little SIG-A. And now these toxins are not bound up by this secretory, by this very protective molecule. So it allows the toxins to inflame and damage cells. It breaks down this barrier, and it causes systemic inflammation. Okay. Now, digestion. People say, yeah, my digestion's okay, or no, it's not so great, but it's not a big deal, I feel okay. Well, it's really important. From a chronic disease standpoint, if you're not digesting your food very well, you may end up creating more inflammation. All right? Undigested food particles that pass through the barrier, they can, and this creates a food sensitivity. You would recognize this as an allergy. So your body's response to that is inflammatory. Here's how it works. Now, you're eating these raspberries, and you're eating these raspberries because you want to be healthy. Well, if they're well digested, you can see here on the left, they're broken down into their individual components. Okay, so they're doing well. So in that scenario, it's a healthy gut barrier, no allergy or inflammation. But if they're poorly digested, here's what happens. You break some of it down into their individual components, but some of it is broken down incompletely, and we get these orange peptides, okay? They irritate the gut. They break down the gut. They pass through that leaky gut, and they cause an allergy or a food sensitivity, and they cause inflammation. So it's really important that we digest our food well, and that we look at markers that tell us how well are we digesting our food. All right. So how do we go from leaky gut to disease? So follow me here. We're going to start in the top left, okay, and follow the arrows with me. So we start with stress, dietary or environmental triggers, a lot of the things we just talked about. That can lead to microbiota changes, all right? Or alternatively, the stress, dietary or environmental triggers they themselves, if you follow this loopy arrow here, can actually cause gut epithelial breakdown or leaky gut. In any rate, both the microbial changes or microbiota changes or the stress, dietary or environmental triggers end up causing leaky gut. The leaky gut results in immune system activation. Your immune system now has to become the sentinel. So there's no more barrier. So your immune system fires up because the toxic LPS are present and they're getting through that barrier. So we create an immune response. It's inflammatory. That immune response, that inflammatory immune response, overwhelms the system. Now we begin to get inflammation in other areas of the body. Believe it or not, we get genetic change. Now we've got genetic change, we get mood change, we get metabolic change, we get immune dysfunction. And it all results in these conditions here at the bottom. Okay? And just as a side note, the inflammation, the genetic change, and all the mood and metabolic and immune dysfunction can themselves cause disease. So now we've got a cacophony of things that are causing these diseases. And we get autoimmune disease, we get cancer, we get mood disorders, anxiety, depression. We get heart disease. And we get something I like to call, or I've seen other authors call, diabesity. So it's a combination of diabetes and obesity. And it's all because we had leaky gut. Now, we know that inflammation is the crux of all disease now. We absolutely know that. Places like the Mayo Clinic, they say this buzzed on inflammation. We've got Harvard School of Public Health, okay, talking about chronic inflammation as the crux of disease. And then Yale, controlling the triggers of age-related inflammation could extend what they call health span. But this whole article was about chronic inflammation, okay? So these big, very well-respected academic institutions are picking it up now that you start to see it in popular media. Women's Health, The Enemy Inside You is chronic inflammation. Time Magazine, The Secret Killer is inflammation. The Wall Street Journal, The New Science Behind America's Deadliest Diseases, chronic inflammation. And U.S. News and World Report, chronic inflammation, reduce it to protect your health. So we know that these things are a major concern, and it's starting to become more and more recognized. And what I'm telling you is that the inflammation is gut-derived. Many times it's gut-derived. So if we fix the gut, we lower inflammation, we reduce pain, that causes, we get a better mood, we get easier weight loss, we reduce our risk of cancer and heart disease and diabetes and all these wonderful things. And you might say, well, I don't really have any gastrointestinal symptoms, so surely I don't have any kind of anything to worry about. Generally speaking, this is what we call a silent killer. A lot of people do not have symptoms, and so they have this gastrointestinal dysfunction that they don't know about, and it's actually occurring and ongoing, and many times it's asymptomatic. So just because you don't have symptoms does not necessarily mean that there's any kind of there's not something going on there. Okay, so here's some cases from my office we're going to talk about briefly. Okay, this is an 18-year-old female. Her chronic primary complaints were brain fog, fatigue, and chronic UTIs. What we found on her stool test was a couple of things. You can see the opportunistic bacteria was positive on her stool test. We also found E. coli overgrowth, a lot of it. And the E. coli overgrowth was significant because most urinary tract infections, UTIs, are from E. coli. Okay. We also found she had some fat malabsorption, as measured by the long-chain fatty acids present in her stool. So she wasn't absorbing her fat-soluble vitamins, A, D, all those, the ones that are important for structural protein, maintaining structural proteins and tight junctions. After the gut detoxification, we eliminated the opportunistic bacteria. We got digestive support. The symptoms significantly improved in just 2 months, just by changing her gut. All of these, the fatigue, the brain fog, the chronic UTI, were much better just by fixing the gut. Next patient, 45-year-old female, debilitating depression and anxiety were the primary complaints. Evidence of high gut inflammation is measured here by calprotectin and her secretory IgA. Hers was very high, which signifies high inflammation. You don't want it to be too high. You also don't want it to be too low. After treating her, my mood is much better. I'm much happier, much more stable. I'm sleeping well. I'm doing so much better. I decided against medication. 42-year-old female, next patient. Primary complaints were chronic pain, mood disturbance, brain fog, chronic diarrhea. What we found was lactoferrin was high. That's some evidence of inflammation and leaky gut. It's a marker called lactoferrin. After treating her, she said, pain-wise, it's amazing how much better things are. My bowel frequency is much better. All right, so she had chronic pain as a big part of her presentation, and we fixed the inflammation. She feels a lot better. And last but not least, 41-year-old female, primary complaints, chronic yeast infections, chronic bacterial vaginosis, anxiety, depression, brain fog, daily headache. So here's what we found. She had a relatively low good bacterial count combined with this pathogenic bacteria called Helicobacter pylori. So that creates this immune imbalance. Okay? We also found that lactoferrin was high. Okay? So her lactoferrin was high. That's evidence of inflammation. So she had bacterial imbalance plus this inflammation. All right? After we treated her, I feel amazing. The brain fog is almost 100% gone, and whatever was in my gut is leaving. I've been decreasing my sertraline, which is a depressant, and I feel very good. Thank you so much. So she did exceptionally well just by eliminating some things. All right, so what are the steps to healing the gut? I came up with this acronym. I said it's easy. Okay, so examine, eat, supplement, exercise, eliminate. All right, so examine. You need to get advanced stool testing done. I think that you need to go through a specialty laboratory and a doctor that knows how to interpret those things, like myself. DNA analysis for the bacteria is really important. That's the newest thing in looking at bacterial counts for the stool testing. Culturing it, where they try to get it to grow, is okay, but you need to get one done that actually looks at the DNA. You should get a stool test that screens for fungal and parasites as well, fungus and parasites. Got to do digestion. Got to look at the digestion, and you got to look at the absorption. You also should look at immune and inflammatory markers. This is a very important, very comprehensive stool test. It's very specific, and it's something that you should be getting done and asking your doctor for. If you find any issues, correct and optimize all those. And then know your nutritional status. And then if you do find any deficiencies, you should get them corrected. Eat. I say call it a paleo-inspired diet. It should be full of vegetables, lots of healthy proteins, and lots of healthy fats. Okay, this is a good cookbook here. It's called the Heal Your Gut Cookbook. Nutrient-dense recipes for intestinal healing using the GAPS diet. And I love this book. It's got lots of great recipes. It tells you how to do this yourself. It's a fantastic book. Get a food sensitivity test done. Whatever food sensitivities you find, avoid them. Regularly consume fermented foods. Kimchi, yogurt is good. Anything that's fermented that contains live cultures is good. Supplement. Now, supplement according to your needs. Don't over-supplement, because that's just as problematic as not getting enough. But, so what are some things that you might use? Well, you might need some nutrient repletion. Okay, you might need probiotics. Whey protein is great because it usually contains immunoglobulins that are very healing for the gut. And you might need things, anti-inflammatory herbs like curcumin. You might need some things like a fish oil, because that's potently anti-inflammatory. Again, there's a lot of different things you might consider. Just depends on your particular it would honestly depend on your stool test or depend on your symptoms. And somebody like myself could either run a stool test and interpret it for you, or sometimes even just through you telling patients telling me what they have in terms of symptoms, we can determine which way to go. Exercise. Vigorous exercise. Okay, vigorous exercise has been shown to be beneficially affect the bacterial profiles in the gut. So what does that mean? Well, it promotes the diversity of the bacteria, and you want to have highly diverse bacteria in your gut. It's associated with much better health outcomes. And exercise, vigorous exercise, decreases pathogen growth. So that's really important. So perform minimally 3 to 4 times per week for optimal health. And step 5, eliminate. So eliminate or manage your stress. Eliminate artificial sweeteners. They adversely affect the balance of the bacteria. Eliminate antibiotics except when absolutely necessary. And then eliminate the overuse of nonsteroidal anti-inflammatory drugs and alcohol. Okay, so if you can do those things, you'll do much better. Okay, good. So I hope you enjoyed our little lecture here. Our gift to you is we do offer free phone consults in our office. So if you have any questions, any comments or concerns, just for watching this, we do offer free consults in our office. Feel free to call us. Our number is 802-649-3122, or you can find us online at www.vreelandclinic.com. And if you do have any questions, please let us know. We have a Facebook page where we post lots of wonderful information. We do have a blog on WordPress. Again, all of this can be accessed from our website at vreelandclinic.com. But please do feel free to give us a call. If I can't help you, I will certainly point you in the right direction. And thanks for watching.